Amid the global scare over coronavirus, a good news has surfaced in Jaipur, where a team of doctors has cured 3 out of 4 corona patients, confirmed cases of corona patients. And we have with us Dr. Raman Sharma, Senior Professor of Medicine and expert of infectious disease. He's an important pillar of the team who has cured these patients. Let's talk to him. And he is India's we'll say COVID warriors of India, and we'll talk to him about the lives and fears about the disease. So doctor, tell us how challenging it was for you.
Yeah, it was extremely challenging when we heard and read in newspaper during the initial days in December 2019 that a coronavirus infection, new coronavirus, novel coronavirus infection has emerged in China. And you see that the population of China is dense, so it could have spread easily to other countries. So WHO on 8th of January 2020 declared the outbreak of this infection from a limited locality of Wuhan. Then it spread over the other areas. The initial cases were from seafood market, those who were in contact with snakes, with live animals, or those who were living in the vicinity of these markets. So 55% of the patients under investigations, what is called as PUI, were from those market areas. Later on, it spread by droplet infection, which is usually a large droplet infection, and it settles down rapidly into something fomites or objects. That's a problem because respiratory small particles, they remain suspended for a time being in the air, so they have more propensity to cause infection to others. But this has the property of infecting others through objects as well. So when we heard that this is going to happen after January and cases were detected from other parts of the world, we prepared ourselves. So we started our CME programs that included awareness about coronavirus infection. We searched the literature, we interacted with the residents, we interacted with the faculty, and found out that the treatment which was used in SARS and MERS could be the answer, because the first aim was to check the spread of the disease, and we must also be prepared to take care of the patient as far as the treatment line is concerned.
Was it scary for you? I mean, how challenging it was?
Oh, it was extremely challenging.
When tourists were found.
This was a novel virus, and we didn't know the exact protocol, what to do and what not to do. So when on 2nd of March and 3rd March, 2 tests of the Italian patient came positive, we held an emergency meeting with our faculty colleagues, including the principal Dr. Sudhir Bhandari, Dr. Subrata Banerjee, who is the head of Department of Medicine, Dr. Prakash Keshwani, and Dr. Ajit Singh, who is the logistic in charge of this hospital. So we ate at 4:30 in the evening. We sat down and decided the protocol. We were already aware of the drugs which were being used in MERS and SARS. There were some studies which showed that these antiretroviral drugs may be effective. Now, to call it maybe, because I am calling it may be effective, because you need large randomized RCTs, randomized controlled trial, to label it as a drug which is effective. So this was a combination of two drugs, and recently 2-3 days back a paper from China has said that it quotes that chloroquine has been used and is going to be used there as well.
Okay. So how was your routine? I mean, how did you prepare yourself in the morning? once the patients were here, confirmed cases, and it must be very, fearful for
Yes.
the team also, for you also.
Yeah, I must tell you that to contain an infection, it is always a teamwork. So we started with our residents, the consultants, we took all due precautions to take care of these patients.
How is life inside this space suits, like personal protective equipment?
Yeah,
Which
this
you use?
this you have to wear for a few hours, and there is nothing abnormal. It is a protection for the person who is handling these patients. So it is very simple, but then it has to be worn in a specific manner. It is to be worn by the personal doctors who take care of these corona positive patients.
Today there was a news that a doctor in Karnataka was treating these patients. He also got infected. So, I mean, in such a situation where the infection is traveling, what fears, what have been your fears, your team fears?
Because I am thorough with the literature about coronavirus, and I would like to emphasize and also tell the public that it's not a very serious infection. Most of the cases they are asymptomatic or only mildly symptomatic, and it's basically a self-limiting disease. In 95% of the patient, the disease is more or less controllable. In 81%, it was found that it is self-limited disease. In 15%, it can cause mild pneumonia, which is the most common complication. But in few of them, it can cause severe pneumonia and critical infection, only in 5% of that. But then our experience of treating swine flu patient really came handy.
Doctor, especially talking about precautions, because when you saw the outbreak here, what precautions did you take here?
Yeah, since this is a respiratory borne infection, we have to be very careful. And patient who are suspect corona patients, they have to be separated in an isolated room. So we have a facility in our infectious disease hospital. We have separate rooms, separate wards. And if the patient turns positive, we never mix negative or suspect patient together, because then if the result is positive, then we have to segregate this patient to a separate ward. So initially when the results are awaited, we do not mix any patients.
And sir, what about the screening? Thousands of people are being screened now. People are scared. They are coming to the hospitals. They want them to screen. And how challenging this is for you? And how many people have you screened till now?
So far, the facilities for testing is not generally available. It is not advised by the government of India to randomly check for coronavirus. There is certain protocol which has to be followed. The protocol has to be followed strictly. Person having symptoms or who has come in contact with a corona positive patient has to be tested. And of course, when we are flooded with patients, so when the patient becomes negative and has to be isolated like foreigners, they cannot go back to their hotel, because still there are chances for the mandatory 14-day period, because they can infect others. So we keep them in secondary facilities, which is Rajasthan University of Health Sciences. There is separate isolation hospital, and there are segregated wards, separate rooms already prepared.